transform this moment of sorrow also at the same time into a moment of hope, of greater service, you know, for each other and to support each other in this time. So we wanted to ask first, Jen, are you doing the poll here or am I doing? Hey, Colleen, good to see you too. Great, so as the country prepares to reopen, how are you feeling? Because the country is starting to reopen. Montgomery County is not totally ready for that, but a lot of Maryland is, a lot of other parts of the DMV area are, and a lot of the country is. So are you feeling not ready for anything to open? Are you kind of more anxious and nervous? It's a multiple choice question. Are you hesitant but ready for some things to open? Are you ready if the proper precautions are taken, or if you're just ready for everything to open? Go get your haircuts, go get, you know, eating out and everything else. Thank you for voting. And like I usually joke about, we want to have a better turnout than the usual general election here for the voting. So I hope you're able to vote and do that. Thank you so much for doing that. Okay, I think we can probably close the polling here. A lot of people are anxious and nervous about it. We're going to be talking today about herbs that help with stress. Colleen will be talking about that. Great to see you on this, Colleen. Thank you for coming on and sharing your expertise on herbalism and herbal medicine. A lot of people are not ready for anything to open. Some people are ready if the proper precautions are taken, and some people are hesitant. So there's a kind of mixed feeling, which makes a lot of sense. And we're just going to have to all kind of roll with it and be with this together. And we'd like to welcome Smile Herb Shop and listeners and Colleen Zuntag here. And Smile Herb Shop is a great place that grows and also sells different herbal preparations, and they're right here locally, so please check them out. They also have a Mid-Atlantic School of Herbalism, which is taught by expert herbalists, and two people I know. One is EJ's mom is a student there, and EJ's been learning from her mom also, and also our practice administrator, Christine Gordon, is also a herbal student. So welcome everyone from Smile Herb Shop that's here for that, and welcome to Colleen. So we'll be talking about a check-in today a little bit of COVID updates and clinic updates. We'll be introducing Colleen, who's a clinical herbalist at Smile Herb Shop, and she'll be talking about herbal medicine and herbs and how that can really impact and influence your health. And then we'll have some time for Q&A on herbal medicine. Thank you all for attending this. We have CIH Tribe as a group page. A lot of you are already on this. I believe Colleen is on this as well. If you're on Facebook, then it's a place that you can connect to your to community online. I know not everyone's on Facebook, which is fine. If someone is, then they can get access to additional information, content, and build some community and meet some like-minded individuals that are interested in health and wellness. So first of all, I don't think the numbers are completely going down yet in Montgomery County, and I do think I agree with the the council members and things that we still need to have social distancing in place in effect at this time. I think one of the things that I would emphasize is that there's been many studies on what's called super spreaders, which are people that essentially, for whatever reason, they account for the majority of the spread of COVID. There's about 5 to 10% of populations based on genomic studies. So there was a study that was just recently released yesterday from Tel Aviv, and it showed that about 5 to 10% of people are accounting for 80% of the spread of COVID, which means that we don't really want to have, although we love to have these parties and barbecues and all these things, this is where, a large cluster of people are going to super spread the illness. So, we still want to be mindful of this. We want to be mindful not only of our desire to socialize and to do that, but we also be mindful of our neighbors, people that might be more susceptible to this. So that's just something to note there. Vaccines are being researched, drug trials are happening. There's a WHO solidarity trial that's happening. The only thing I want to say about this is that the hydroxychloroquine arm has been dropped from the trial because they've been having some safety concerns from cardiac issues with hydroxychloroquine. So I think it can be considered for individual people, but it's not something we would necessarily recommend as a population. Our clinic is fully stocked with personal protective equipment, some of which is from Jula Medical in Rockville. So we want to thank you for that so we can keep on serving people here. And then if you want to test, if you want to screen yourself, we do have a way to do that through here to see Paula here, a PA here, that's doing that part of things. And we're going to have people get blood antibody tests through LabCorp, which is near perfect accuracy for their presence of antibodies. But there are strengths and limitations to antibody testing because antibodies don't tell you about the B cell strength or response. It doesn't tell you about T cells. And so there are some limitations to even antibody testing itself. So one thing I wanted to say is that coronavirus is going to be here for a while, it seems. So optimizing lifestyle, optimizing nutrition and movement, and other natural therapies to help your whole mind, body, spirit is going to play a much larger role, an increasingly larger role in determining the state of your health and wellness. So we have this is a little graph that I got from Duke here, is COVID and the immune symphony. It's not just about the B cells and things that are going to be helpful for antibodies, but it's about the T cells, about how they all interact, and about your gut microbiome. So all these things affect your body, your health in a synergistic way. So we have to consider all these things. So from a functional medicine, a root cause physiological perspective, even though in the FDA there's no proven treatment or prevention that's been proven, COVID-19 basically is which I use my term here, is a acute inflammatory response syndrome, or AIRS. So really this acute inflammation and blood clotting that affects different parts of the body, not just the lungs, but also the kidneys, liver, brain, and heart, essentially is causing the systemic inflammation and basically your immune system on overdrive. So I won't go through this whole entire slide because I did that last week, but essentially you need to look at all parts of your body. You need to manage physical stress, psychological stress. You need to reduce inflammatory inputs in order to kind of come through this here. So ensuring both immune system strength and tolerance is the key to maintaining and optimizing the immune system, which herbs can play a big part in, acupuncture can play a big part in that. I am doing a group class, and I would like to offer this to our current patients, but also to listeners from SMILE if they're interested. This is something that we can do for you as well to optimize your immune health. We're doing a group class. We're going to bill that to insurance. You can contact Gina, who's our coordinator for that, at that number there, which is 301-602-2372. And I'll show a couple of slides here that you can contact Gina with interest in any of these things. But we're going to do a third immune class because the first two classes are already full. And then in June, Katie, our functional nutritionist, and I are going to plan on a gut health virtual group class as well, in order to be a better service to you and get this information out there so you can better your immune health. Meg wanted to introduce again. She's our new IV nurse, second IV nurse. Laura's our head IV nurse, and Meg is now coming on as our second IV nurse. She's also a student at MUAH for nutrition. She's a really great person, great energy, and really great with IVs as well. And IV nutrition therapy is another avenue to boost the immune system that we're going to discuss in more detail. Laura and I will discuss that in more detail at next week's town hall. So please contact Gina again to offer to our current patients and also patients at also clients rather, or listeners at SMILE. I think that would be another avenue. If you're interested in IV therapy, you can contact Gina as well. It does require a brief intake visit and some safety labs that we can bill to insurance. Dr. Hiza, who's a friend of mine, and he's also a doctor of physical therapy who has amazing results with reversing osteoporosis and treating different acute and chronic pain conditions and optimizing functional movement patterns. He started a couple weeks ago, and he's partnering with us. His company called Cambia Physio is able to see CAH patients via insurance. So if you're interested in that as well, it's another thing that we're doing here. He's available Monday, Wednesday, Friday, and that's been great. So thank you for Dr. Hiza for partnering with us too. Great to have you here. And then EJ is our physician assistant, who has been wonderful, and she's been great. And we've been basically training her for the last several months, over at least half a year at this point. And she is going to be starting officially on Monday, June 1st, seeing patients. So basically very soon. And she's trained with me in integrative primary care and functional medicine, and she'll see ages 18 and up. And you see the things there that she's able to do here. Including optimizing gut health and hormone health and helping with the immune system here. And you can contact Gina to schedule with her as well, with EJ. And then Corey, and then we'll have Corey, I think I could stop my, do I stop my share, Jen, on, let's see, Corey can talk a little bit about his practice?
Yeah, sure.
Okay, so stop share. So Corey here will be talking here. So I think a lot of you know Corey. Just see. And great to see you on this, Corey.
Yeah, hi, am I, tell if I'm live.
You're on, yes.
All right, great. Great to be here. Just wanted to hop in and just share my excitement to get back into practice, and really looking forward to serve patients again. It's a big part of my life that's been missing, and I'm sure some relief to people has been missing as well. So starting my practice back on June 1st on Monday. And then I'll be starting with Mondays and Wednesdays, and then add on to Fridays as volume starts to increase. You know, we'll be using all the proper PPE and, you know, all the standard protocols that are now in place. And it might seem a little bit sort of strange and new, something new else to adjust to here, but it'll become very common and normal after a few times. And we'll, so, you know, all my existing patients, saw a couple of you on here. Wonderful to have you back. If you feel comfortable, we'll be reviewing your case and making sure that you're sort of, that it's okay for you to come back. Most people that we've been interested in were taken just fine. And then, you know, helping you with the conditions that you might have been missing from my treatment. I know we've had to adjust a lot and make some different adaptations, you know, to get to our place that we are now. And then as we start to move in a new place, you know, another major transition to get to there. And so any patients that are interested in starting up with acupuncture, you know, as Dr. Wong mentioned, it's great for, you know, immune health, building immune health and maintaining it, but as well as pain, stress, anxiety, particularly useful for anxiety and nervous system sort of regulation. There's been a lot of adaptation from your nervous system to adjust to these different sort of completely new environments. So it can help things settle down, you know, turn the volume down on some of these sort of anxieties and things that I think will be helpful for people. So if you have any questions about acupuncture, starting it up, or any existing patients and sort of what this will look like as we go, I'd like to just give you as much information as we know as possible. So happy to have a call with anybody or back and forth on the portal to answer any of those questions. You know, as much information as we can share is helpful. So any bit that you need to feel comfortable with that. But besides that, I'll probably be joining you on a Zoom call here and later in June, and maybe share some sort of anxiety techniques and some strategies to sort of help ourselves at home that I've been relying on myself. And I think that's it. That's all I got. Looking forward to seeing you guys. I grew a beard while I was gone. Those that do recognize me.
Looks great, Corey. You've been working on some woodworking too, right?
Yeah, I just I built some furniture and doing a lot of renovations in the house. I'm a little dangerous when I'm at home and only the hardware stores are open.
I looked at your site on that. It looks really good. I think better than some of the furniture stores, you know.
Yeah. Yeah.
I'm going to share the screen again. I just wanted to emphasize that we have screening standards in place, and we have personal protective equipment in place to ensure your safety. We probably have now too much PPE. I've just ordered a bunch more. Have a inside connection in Rockville there that's been able to help us, Jewel Medical. So I want to thank them for that. But please contact Gina to schedule a new patient visit with Corey, or an established patient. If you're already an established patient with Corey and want to get back. And acupuncture, I've found personally to be one of the best known treatments to boost and balance the immune system. So great to see you today, Corey, and look forward to seeing you Monday. Just wanted to, you can kind of look at this and there'll be recordings later, but this is a summary of some of the service updates of who's available, you know, here, who's kind of starting back up. You know, I know we're going to do an update soon on Carrie's practice, updates to follow when she's going to restart. So that's exciting. EJ is going to start, you know, Meg is starting. So a lot of people are kind of restarting, and, you know, it is kind of like a late spring type of thing here, you know, for this. If people are interested in the brain scan, I think some people are interested in neurofeedback and brain health. So Nick is going to restart that every Thursday starting in June. So you can message him directly in the system to schedule, and we'll update health coaching and many more updates to follow in the weeks to come. So thank you for listening to that update. like to, and then Gina, again, that's her number if you have a question about the patient process, if you're not a patient yet, or if you want to just kind of talk to her about what we're doing here in the office. We are accepting new patients via telehealth to start with, I think, first. And then in person, also is available starting in June as well. So I just wanted to do one slide, which I know Colleen's going to have much more than on this, but just an overview of this is that, herbal medicine is really the foundational basis of medicine. It's really traditional medicine. It's very plant-based. And we know that, in terms of natural healing, herbs work with the body's innate capacity to heal. The body's always trying to heal itself. So, herbs really, what I really wanted to say in this slide was that herbs really connect us with the earth and with nature because we are nature. So it's working with the body instead of against the body. So it often has fewer side effects than conventional medication. It has, often more affordability and accessibility. You can literally go out. I think this weekend I was cooking with some thyme and oregano I found in the backyard in a pot that I didn't even know was there. And it was great just to like see the thyme flowers and to like go around the yard to figure out, what I had there. But it can really reduce stress and optimize immune health, and it also stabilizes hormones and metabolism. So these are just some of the benefits of herbal medicine. And I'll hand this over to Colleen Zuntag here from Small Herb Shop. So first of all, Colleen, thank you so much for joining us today. And we're really glad to have you and have Smile here too.
Hi, thanks, Dr. Wong. I'm so happy to be here. We had a little bit of technical difficulty this morning, so we're going to try
Zoom,
and see how this works. I'm so happy to be with you guys and to share some plants with you. Can you hear me?
Yes, thank you.
Oh, okay. So we're going to start. We had planned on doing an herb walk this morning, but there was thunderstorms, so we tried to do some video, and now we're having technical difficulties. So we're going to start with the video with for the elder tree. And then I'll take questions after that. And then we will show you some more videos, some wonderful plant medicine. How does that sound? Let's start. Hi, everybody. I'm Colleen Zuntag. Super excited to be town hall today. Thank you for inviting me.
Hey, Colleen, we can't hear the audio on the video.
Okay.
One thing you could try is when you go to share screen, there should be a button that says advanced, I believe, and you can share your computer audio directly.
All right, let's see. Okay. How is this? Let's try it. Let's try it again. Hi, everybody. I'm Colleen Zuntag. I'm a clinical. Is that better?
That's better. Yep.
Okay, thanks, Jen. Hi, everybody. I'm Colleen Zuntag. I'm a clinical herbalist, and I'm super excited to be part of your town hall today. Thank you for inviting me. I am today going to share with you the medicinal plants in my yard and possibly give you some recipes. I'm standing in front of an elder tree right now, the sacred protective tree. And most people have used elder berries for cold and flu, or if they as an antiviral. It's really popular medicine in the fall during cold and flu season. But today I want to talk about elder flowers. Elder flowers are also very medicinal. Actually, the whole elder plant is considered a medicine chest in and of itself. But the flowers and the berries are the most medicinal parts that we use with the least side effects. So the flowers are cooling and relaxant internally. We can use them for fever management. Somebody is feeling really, really hot to the skin as they have their fever. We don't want to suppress the fever because the fever is not an illness. The fever is the body doing its work to help fight the virus or bacteria that's in the body. So we use elderflower in formulation with other diaphoretics to help with fever management, to help the body do what it needs to do. And so if somebody's super hot, you'd use a cooling, relaxing diaphoretic like elderflower. If they are feeling kind of lethargic with their fever and they're cool to the touch but maybe feel hot inside, you can use elderflower with some stimulating diaphoretics like yarrow or peppermint. Maybe add some lemon balm or lemon verbena to that formula and to help manage the fever. Internally, you can also take elderflower as food. One of my favorite ways to use elderflower for food is to make elderflower lemonade, and I can give you the recipe for that later. People have used elderflower fritters and jams and jelly. It's very delicious, and it's safe for kids, and kids love the taste too. You can also use it topically. It softens the skin, so you can use it. It's great with calendula and chamomile topically as a skin conditioner. One of my favorite ways to enjoy elderflowers is to make elderflower lemonade. They're not quite ready to make lemonade yet or to harvest. They're not quite open, as you can see. We only have a few of the flowers that have opened, the buds that have opened. But when they're opened in about another week, you will gather about 12 to 15 elderflower heads, this whole head. Use about 2 to 3 lemons, depending on how lemony you like your lemonade. About a cup of raw honey, and about 3 to 4 cups of warm water. And so you take the warm water in a half-gallon jug, and you add the honey and allow the warm water to dissolve the honey. And then you will layer the elderflowers with sliced lemon all throughout that container, that glass container of water and honey. And then you cover it with a cloth. I use paper towels and put a rubber band around it, and then I let it sit in the sun for 2 days. And after 2 days, I taste it to see how it tastes. If it's lemony enough, it can get a little fermented, effervescent, a little bubbly. If it's not quite bubbly enough, I might let it sit for another day. And then I bring it in the house and strain it and put it in an airlock bottle and let that sit in the refrigerator for a few days, and then you have a delicious elderflower drink. Historically, the elder tree has been used in medicine. It's considered a medicine chest in and of itself. In modern times, we just use the flowers and the berries for medicine, but traditionally they would use the leaves and the stems as an emetic or purgative, meaning help you vomit or release waste as a laxative, severe laxative. We don't usually use it in modern times like that. It's too severe and too harsh on the body. You can use the leaves topically as for bruises. Most people know elder for its berries. It's a widely advertised medicine in the fall for cold and flu season, and it is really good cold and flu medicine. It's antiviral. Studies have shown actually that elderberries can inhibit the replication of viruses in the body. No research has been done on COVID-19, obviously, because it's so new. We're still learning about that virus, so I don't recommend it for that. But the berries are very nutritive, also full of antioxidants, and help nourish the body and support the body's natural immune response to viruses and bacteria. So ways to use elder, the whole plant. We use the flowers in tea. If you want it for fever management, use it as a hot tea. That will help facilitate the diaphoretic actions in the body, so to help release that fever from the body, release the heat from the body. We use the berries as syrup or tea, and you can also make jam with it. Okay, I think that's the first video. Let's see if anybody has any questions about this. Anybody have any questions about elder?
There
see.
are two questions, I think, in the chat for you
Okay.
from Ellen.
Let's see. Not what else do you recommend? Is there anything that helps chemo patients taking oral meds without regurgitating after taking? I think I would need to know a little bit more. You could try ginger. Have you tried ginger for your granddaughter? You can make it in a tea, or you can take ginger as a powder and mix it with a little bit of honey. And that can ease nausea, even with chemotherapy patients. Some people have used astragalus to help with that also in small doses in a tea. Let's see. Got a few other questions. Can you hear me, Selena, now? Let's see. Where's Smile Herb Shop? Smile Herb Shop is in College Park. It's at 4908 Berwyn Road in College Park. If anybody wants to go there, it's a great place. They're not open right now for walk-ins, but they are doing phone orders, email orders, and they're doing, you can drive up to the parking lot and pick up your order. Okay, thanks, Selena. Anne and Angela, maybe they can hear it now. Let's see. Thank you, Dr. Wong, for putting that link up.
Colleen, would you mind sharing your camera so we can see you?
Oh, sure. Let's
Sure,
see.
Colleen, thank you.
There we go. How's that? Okay, let's see. Black seed oil on and off since April for 2 months to combat inflammation. You know, inflammation is a really big topic. I'd need to know more about what kind of inflammation you're having. So we'd need to talk about that. I'm taking on Thursday afternoons from 2 to 5, I do free mini consultations if you have any more questions beyond what we're covering today. They're just like 5 or 10 minute quick conversations about anything like this. So Ellen, if you want to call me, then you can. The number is 202-695-3912, and I can ask more questions about your inflammation. That's a big topic. Yes, elder is safe for autoimmune patients. I have 4 autoimmune diseases, and I do use elder myself. I have lupus and Hashimoto's and Graves' disease and fibromyalgia. It is safe. So you also, generally considered safe. You have to just check in with your body with all of these things. So lower doses, and it depends on what you're using it for if you're an autoimmune patient and other medications you might be on. But generally it's considered safe. You can buy the elder plant. Let's see, I will have to look into that. Smile might be carrying plants later on. You can check in with them, or a lot of nurseries carry elder, and there are places online you can look for it. How effective is elderberry syrup you buy? Sue's asking. And the store-bought elderberry tea. I think they're effective. You just have to, it depends. If you're using it prophylactically or, to support the body in general with nutrients, you can do lower doses, 1 to 2 teaspoons, follow the directions on the bottle. I do think it's effective along with a healthy diet and other ways of managing stress and managing your immune system, right? Herbs are very effective, but they work in partnership with a healthy lifestyle. So nutrition is super important. All the basics you do for supporting a healthy immune system help the herbs work better. I do like making my own elderberry syrup. It's less expensive, and you can make it to your energetics. If you're a dry person, you can add more moistening herbs like marshmallow root. If you're more, if you're kind of a person who holds a lot of fluids and you have a lot of phlegm, you can add more drying herbs to that, like ginger. So I personally like making my own elderberry tea and syrup. Thanks, Selena. Scar therapy. So we're going to talk about calendula in a little bit, and you can use calendula oil for scars. You can also use castor oil topically for scars. It just takes a long time, and you have to be consistent. Elder is not difficult to grow at all. It is so easy to grow, and it actually, as it drops the seeds, I cleaned out my garden this year, and I have about 30 new seedlings coming up, and it's very exciting to see that. It likes damp areas, partial sun, not too wet, but a little bit damp. And it's an understory shrub or tree, so it likes to have a little bit of shade. Son has 6 stitches on his chin from Sunday night. Topical scar therapy. Did you see that, Selena? I would add, as long as the wound is already starting to heal, I would add some calendula oil to that, and you can use yarrow also as a wash. Thanks, Jen. Jen put the phone number on for this on Thursday afternoons if anybody wants to call that. Let's see. I've heard to help immune system COVID-19 use glutathione and liquid. I'm not sure, liquid vitamin C. So I prefer to use natural ways to support the detoxification process, but of course we do supplements also. Glutathione is, a part of the body, it helps the body detox. So you could try that, but you also can do other things to support natural glutathione production in the body. One of the biggest things is getting enough sleep and eating a healthy diet. So that helps the liver produce glutathione to help with the detoxification process. Vitamin C, you could probably get some liquid vitamin C online. I prefer to use rose hips, or you can use amla. Amla is one of the highest sources of vitamin C. It's an herb from India. So that would be my preference, to get your vitamin C from sources that have been the least manufactured. Echinacea for autoimmune conditions. So I personally believe that echinacea can be safe for autoimmune conditions. It needs to be watched. It depends on what stage of the autoimmune condition a person is in. If they are really having a lot of flares, I would not do immune stimulating at that time. I would do immune modulating herbs like astragalus or reishi. They help modulate the immune system. So it just depends on what stage of the autoimmune response the person's in. So otherwise, I've used echinacea myself, but only when my immune system is already modulated. Yes, elder is where elderberries come from. So the official name for the tree is Sambucus nigra. We use black elder, and it's called an elder, but we just say elderberries. So you can use elderberries, you can use elder flowers, and traditional peoples, especially in Europe, used the whole plant. I love castor oil packs for digestion. That's one of my favorite remedies. If you ever see me in the herb store, yes, you can use castor oil packs on digestion. It depends on what your digestion's like. If you have a really hot digestive system, you might not want to do that. If you have a lot of acid reflux and burning gastritis, I would go slowly with the castor oil packs. I would calm things down with some cooling teas first. There's lots of things you can use for a hot, heated condition for digestion. But if you have slow, sluggish digestion, yes, castor oil packs. I've used them on the colon. I've used them on the liver and gallbladder area. They can be very helpful. It just depends on what's going on with your digestion. Also using other things. If you have insufficiency with your digestive secretions, then you might want to take some bitters to help produce more secretions so you can absorb the nutrients from your food that you're eating. Let's see, does elder plant hold up in the winter months? Yes, it does hold up. It'll go dormant, and then in the spring it comes up again. It's very, very virulent and strong. Let's see, hypothyroidism. So there's a lot of discussion about hypothyroidism related to iodine. So iodine is a nutrient we all need, but we only need it in really small doses. So you have to be very careful. If you take too much iodine, you can push somebody from hypothyroidism into hyperthyroidism. So you have to look at the whole picture. Again, I keep saying that, I know, like a broken record, but it is really super important to not just pick one supplement or one herb or one vitamin or mineral and say, this is what's going to cure my hypothyroidism. I have Graves' disease and Hashimoto's thyroiditis, which one's hyper and one's hypo, both autoimmune. And believe me, I've done that to myself. So I can speak from experience that you have to be careful, and you want to, it's a chronic autoimmune condition. So you want to get to the root of it and start looking deeply about what other things are contributing to it. Is the diet, is it really obvious deficient in iodine? You can also get tests to see if you're deficient in iodine. But there are a lot of things that can contribute to hypothyroidism. So we'd have to look at the bigger picture. Rose hips and amla. Amla is A-M like Mary, L-A. And rose hips. Rose hips are great. They're also really high in vitamin C. And it's a full spectrum food, amla too. Amla is one of the basic plants in, 3 fruits in Triphala. I don't know if anybody uses Triphala. It's used in almost a lot of Ayurvedic remedies as a base. Triphala is, and amla is one of those plants in there. Menopause. Can't take any estrogen because of blood clotting disorder. Menopause is another huge, huge topic. It depends on where you are in the process, what kind of symptoms you're having, and your health history. Let's see. Are you feeling dizzy? My screen not stabilized? Let's see if I can do that better. Medicinal plants from Smile. Last year, where can I buy more? So I like strictly medicinals. They're on the West Coast. That's where I buy a lot of my plants. So you can check in with them. Strictly medicinals. Signs of hypo or hyperthyroidism. So hypothyroidism, some of the signs can be deep fatigue, not just like you're tired and, you know, after a long night of no sleep, but like this really deep sluggish fatigue, hair loss, irregular menstrual cycles or no menstrual cycles. High cholesterol can be part of that picture. Hyperthyroidism it's an excessive condition. So hypo is deficient. So you can imagine the person's more sluggish, inactive, feeling in their body. Even if they're trying to be active, they can't get the energy up to do what they need to do. And so there might be some depression with that. So think of all the things that can be part of a deficient syndrome. Hyperthyroid is more excitable, more manic, hair loss still also. They can also have insomnia, severe insomnia, weight loss, even though they're eating a lot of food, voracious appetite. They can have high blood pressure. Those are the differentiations between those two. Is it safe to use Triphala daily? Yes. Yes, I think Triphala is great daily, just as a supplement. Let me just get my computer more stabilized here. I'm worried I'm making you guys seasick here. Okay. Yes, Triphala, I mean, you know, I do take breaks from supplements. I take Triphala almost every day myself, but every once in a while I'll take a break. So if I take it every day for 3 or 4 months, I might take a couple of weeks off and then start over again. Triphala is super nutrient, super nutrient food, but it also tones and detoxifies gently over a long period of time. So I like to use it consistently over a long period of time and then take a break every once in a while. Herbs high in iodine. You can use, maca is high in iodine. Ashwagandha has some iodine and is known to increase thyroid function if you have low thyroid. Seaweed is really high in iodine, obviously. So you can try those. Collagen for smoothies, slacking skin. So vitamin C is super important and to help with collagen production in the body. So I would use amla again for that, rose hips, but I love gotu kola. Gotu kola is superior herb for connective tissue. So that's a plant you can try. And I'll spell it Gotukola. It's 2 words. You can use collagen too. I mean, you know, but I prefer to get it from food. You're welcome, Selena. Yes, amla and rose hips, Natalie. Avoid gas after eating. So again, it depends on what kind of person you are, but the safest one I can recommend for overall for people if they're heated or if they're a more cool person would be fennel seeds. Fennel seeds are a wonderful tridoshic herb to use if you have gas after you're eating. So I would use one, you can do a teaspoon per 8 ounces of water and simmer it for 15 or 20 minutes with the lid on and drink a cup after you eat. You can also add a little bit of ginger to that. I like to add chamomile. So for post meals. So it's a good way to think about helping your digestive system. Taking a little bit of bitters before you eat gets the digestive secretions going, and it'll help your body break down the nutrients that you're eating. And then afterwards, you can have a nice cup of tea like chamomile with some fennel in it, and that can help with gas afterwards. Insomnia is also a huge, huge topic. It depends on what's causing the insomnia. Pots in yard for people in the DMV area. In pots in your yards, I would grow some holy basil, mints. Let's see, chamomile grows in a pot. You can grow that in a pot. Triphala is Triphala. That's for John. Hashimoto's thyroiditis. That's all right. What did I use for Hashimoto's thyroiditis? I did not use ashwagandha because I have an adverse reaction to ashwagandha, but I know I do recommend it for other clients. So I would start there depending on what your symptoms are and where you are with it and what medications you're on. So first thing I did for the Hashimoto's thyroiditis, I had to change my diet. Throughout my process of trying to get healthy, we discovered that my son has celiac disease and I also have antibodies to gluten. So I went gluten-free and dairy-free and completely went off of white sugar and most processed foods for a healing period of time. till my body could normalize. And so I used immune amphoterics. I used astragalus because I was more of a deficient person. The Graves' disease was more prominent in my body, so I had a hard time gaining weight. So astragalus is really good for deficient type people, and it's an immune modulator. So I used astragalus for my main therapy. And I also used acupuncture. It was a huge, huge help for me. So I really recommend, if you can do it, to use other therapies to support it, because herbs are wonderful, diet, nutrition, and sleep, of course, but sometimes we need more than one therapy, and actually most times, depending on how severe the disease is. Poor fat absorption, bitters. I would recommend bitters. And so you can get that in a tincture from Smile Herb Shop. They have some bitters. One of my teachers, Betsy Miller, makes a wonderful line of bitters there. And that can help stimulate digestive secretions to help with poor fat absorption. That's just a general start. You might want to think about, I don't know if you have fatty liver also, or I just would need to know more information to make other recommendations, Liz. Many women are low in iron, and you seem to be quite high. I can't think of any. I know there are some therapies to help lower iron, but I can't think of any off the top of my head, Angela. So if you want to call me later on at 2, I can do a little more research, or next Thursday. Yes, Natalie, go to Cola. That's right. Medicinal herb for overall maintenance. No, I wouldn't say there's one herb for overall maintenance for everybody in the population. Sorry. And I would do, I even think about using herbs for different times of the year. So if it's spring, you might use a different set of herbs than if it's summer, and if it's fall, depending on what your constitution is. So think seasonally, and think that you're a part of nature, and you want to support your body as nature goes through her seasons too. So it depends on what season it is and what kind of constitution your body has. And then you can come up with a formula for your body throughout the year. I don't believe ashwagandha increases blood clotting, but I'd have to do more research, Jennifer. Gotu-kola effectively, yes, it is. Oh, for cellulite, I've heard people use it for cellulite also, but I think of cellulite as an internal condition, and once it's deposited on the body, I think you need more stimulating topicals, like some cayenne or coffee. They have coffee oils, cayenne. But gotu-kola does increase the connective tissue. It's therapeutic for connective tissue, so I would do it internally. Yeah, I mean, it's, once the cellulite's on the skin, it's really hard to get rid of. So you would need to use it as part of a whole regimen to get rid of cellulite on the skin. You could use, infrared therapy if you can have access to a sauna. You can do seaweed baths to help with that 2 or 3 times a week, depending on where you are with iodine. If you're hyperthyroid, I wouldn't do too many seaweed baths. You can do seaweed baths, magnesium salt baths, Epsom salt baths. All those things can help with cellulite. But the diet really is key also. You have to stay hydrated, and you have to have a really nutrient-dense diet. Best way to get vitamin C, I believe, is from food and herbs like rose hips and amala. Heal the gut during and after antibiotic course. So probiotics are great. Fermented foods are great. Those are the best way. It depends if you are having really leaky gut post antibiotic course. I would work with calendula. Gotu-kola again is great for healing the stomach lining to help with leaky gut. You can try some plantain, also can be helpful. In a tea, 3 cups a day. You think you have Lyme and that's insomnia. That's super complex, Monica. I'm so sorry. That is really complex. So we would need to look deeper into that. I can tell you a resource in the meantime you can look up is Stephen Buhner. His last name is B like boy, U-H-N-E-R. Stephen's his first name. He has a lot of free resources online to support people with Lyme disease. And so that might be a better place to start for you. He's a really well-known herbalist. Hi, Livia. Okay, Livia is the store manager at Smile, and she has put the phone number up for Smile. It's 301-474-8791. If anybody has any questions, and Olivia can help you with those products. Natalie is saying ginger chamomile fennel. Yes, yes. You want to get tested for what? Natalie, I'm not sure. Is that you asking about where would one get tested for those things I mentioned? Allergic reaction, PCP. I'm not sure what you mean, Natalie. Whoever's asking about the testing, if you could just give me more information, I can help. Acid reflux is also tricky. So the first thing in healing is try to remove whatever is causing harm. So diet is super important. So if you're, and you have to be really stringent while you're in the healing process. You might not have to be off those foods for the rest of your life. But really, if you want to heal acid reflux and you've had it for a long time, I don't know if you're on proton pump inhibitors right now or what else you might be doing to manage that. It can be pretty complex, but the first thing you want to do is remove things that are causing harm to your body. And after that, you can work with herbs like calendula, and I would start with calendula, start there with acid reflux. Marshmallow too, marshmallow between meals, marshmallow powder, you can have a half a teaspoon on an empty stomach 2 or 3 times a day. That's pretty safe. Take it away from any medications you might be taking because it's high in fiber and it can inhibit the absorptions of any medications you're taking. So Janelle, it just depends on where you are with your acid reflux. Bitters for fat absorption, yes. Yes, bitters are a tincture from Smile. So bitters is a formula usually. You can do single bitters if you want, like blue vervain or chamomile is even slightly bitter tea. But they have combined prepared bitters at Smile, and you can talk to them when you call them, and they can give you some idea of what kind of, what formulas they have. So your 20-year-old daughter has outside allergies year round. Supplement still struggles. So to me, the best overall herb for allergies is nettle leaf. You can get the freeze-dried nettle leaf for your daughter, but I would really look at her digestive system. Digestive system is the key to health. I don't know if she has eczema also, but you need to look at remove things that are offending her body. If she's allergic to dairy, if she's allergic to other things, she really needs to clean up the diet, and it'll help the body have less of an overreactive response to environmental allergens. So you can think you need to, remove that histamine response, or, remove those offending things that cause a histamine response to the body. But nettles would be the first place I'd start. Fatty liver. I would start with milk thistle, Lisa. Milk thistle capsules. I like Gaia Herb brand. And if you already have fatty liver, I would recommend the supplement form of this right now when you're at that stage of a condition. So milk thistle, 600 milligrams a day is pretty safe across the board for anybody with fatty liver. It's going to take time. So, imagine 3, 6, maybe 9 months, 6 to 9 months more so. I'm not sure if the presentation is going to be saved. Natalie, about cellulite. Hydrate and good nutrition. Yes, seaweed baths massage. Yep. Seaweed baths, Epsom salt baths. Yeah. Thank you, Dr. Wong. He's answering about the blood circulation for ashwagandha. Yes, Dr. Steve Muner's great. Yes, he's great. 12-year-old's taking a course of Keflex for his laceration. Wondering how to keep his gut healthy, keep his diet healthy. So I think one thing it's kind of tricky, we're in this modern society, we have access to food all the time, whenever we want it. And, when we lived less of an industrialized life, we didn't have access to so many foods. So now it's kind of hard to think, oh, I've got to stop things that cause me an upset stomach while I'm eating, or things that can compromise my immune system while I'm healing. So I would say, remove things that can inhibit his body from being healthy, like sugar, processed foods. Make sure he's hydrated, eating, broths, chicken stock, or even if you're a vegetarian, you can just do strong vegetable stocks also with some astragalus in it. And that can really help keep his gut healthy. Testing for autoimmune disease. So you can go to your doctor and you can ask, so it depends on what symptoms you're having, but 2 big markers for inflammation in the body can be starting points are the SED rate, S like Sam, ED, and the C-reactive protein. I would start there, and depending on what other things you have going on in your body. You can also get a CBC, a complete blood count. You can see if you have any inflammation going on there, if your white blood cell count's low or eosinophils high, just check those basic numbers. A comprehensive metabolic profile is also helpful too, I think. See what's happening with your kidneys and liver. But the SED rate and C-reactive protein are 2 inflammatory tests that I would recommend if you're testing for autoimmune disease, just as a start. Oh, good. Dr. Juan already answered that. Okay. Good for herpes virus. So herpes simplex 1 or 2. This is a place where I'd use supplements along with herbs. Lemon balm is good for herpes virus, but again, you want to support the basic function of the immune system. So depending on what kind of person you are, if you're more of a deficient person, I would work with astragalus. And actually studies are showing astragalus can also help with HPV. So you can try astragalus as long-term support over a long time. Again, this is going to take time. And then I would supplement with L-lysine, 300 milligrams 3 times a day. And if you have an outbreak, you can go up higher to like 1,500 milligrams a day. Staying hydrated, again, you have to keep your body and your immune system healthy by nourishing it with real food and eliminating factors that can inhibit your body from healing. Sue Gordon, postmenopause, late 50s, slow metabolism, gaining weight. Yeah, that is very common. Postmenopause in your 50s, our metabolism does slow down and gain weight. So I would recommend ashwagandha in this case. I don't know any of your other health conditions, but I think that's relatively safe depending on what's going on with you. Do you have hypothyroid, Sue? Can you let me know? And if you're on any medications? Let's see. Berberine, golden seal for fatty liver. No, I would not do that at all. Golden seal is an endangered plant, so I definitely would not do that. Use golden seal in particular. Golden seal is antimicrobial, but more specifically for mucosal membranes and for a specific condition, like if you had H. pylori or if you had an infection on your skin. Golden seal is not safe for long-term use in the body. It will disrupt your gut flora. You can try Oregon grapefruit if you want to. As a plant, it's high in berberine. It's safer long-term, similar properties to golden seal. But milk thistle is the best bet, in my opinion. Sinus conditions, depends on what's going on with your sinus. Are they wet, dry? I just need a little more information. Let's see, bloating, methane gas from unknown sources. Elaine, I'm not sure. It depends on, I need more information. But you can try, again, ginger with some fennel. And so the thing is, you have to do these things long period of time. And it just depends on what's causing your bloating. Are you eating things that are that your body's not able to digest properly? And if it isn't, we can look at digestive secretions. But symptomatically, you can start with some fennel and ginger tea, maybe some chamomile. No medication, Sue. I would start with ashwagandha. I do start with a half a teaspoon twice a day of the powder. You can put that in a smoothie, and then you can build up to a teaspoon twice a day after about a week of on doing that. And that can be a long-term support. That's just a start, of course, Sue. That's just a basic start. Make sure you're getting good sleep and you're exercising. That will help actually give you more energy. You're welcome. Chronic stress, Janelle, that's a big one too. So again, it depends on what's going on, what kind of body you have, if you're an excessive or deficient body. But the first thing I go to that I think is generally safe for most people, and I'm not sure how stress affects your body. Do you have a lot of muscular tension? Does it affect you digestively? Do you get more headaches? But the first herb I would go to for chronic stress would be holy basil. And I would drink it in a tea form, about a teaspoon to a tablespoon in a cup of water. Steep it for 15 minutes, drink it 3 times a day. Wet sinuses. Mustafa, you can do the neti pot. I recommend doing a neti pot, which is a saline rinse in your sinuses, and then doing a nassia oil afterwards to nourish the mucosal membrane. But you have to look at what's causing the sinus issue. So you want to look at are you having allergies? Is it an infection? If it's an infection, Smile Herb Shop has a great sinus blend tea. And I would recommend taking that also while you do the neti pot and the oil drops in your sinuses. Anxiety and depression are also really huge topics. I think it's better if you just call me at 2 o'clock for that one. It just depends on how it's manifesting in your body. Relax muscles that are stuck in contraction. That's a great question. First of all, I would use a supplement with herbs in this part also. I would start with some magnesium citrate or glycinate. I like both those types. And the muscles that are stuck in contraction, depending on what the cause is, I don't know if this is from stress or if it's chronic injury or if there's another condition going on, but herbs that I use for muscle relaxation are skullcap, chamomile, and wood betony. particularly the pedicularis type of wood betony, but you can use the Stakes. So wood betony, skullcap, and chamomile, and you would need higher doses. So probably a tablespoon per 8 ounces. Drink 3 cups a day. Let it steep for 20 minutes. And before bed at night, if you find it's waking you up, you can make a stronger infusion. And like I would say, half a cup of herb to like 3 cups of hot water. Let it steep for 4 hours, and then drink a 1/4 cup at a time. And that can help really release things. Let's see, the third herb. Oh, pedicularis. That's the botanical name. The common name is wood betony. B like boy, E-T. I guess I can type here. Sorry, I'm just seeing this. It was hit with all those questions. Here's the name. So there are 2 types of wood betony. There's Stakes. Let's see if I'm spelling this right out. And pedicularis. So I like pedicularis, more systemic body, skeletal body relaxation, and Stakes for tension in the neck and above in particular, but they can be pretty interchangeable. I'm just being a little picky there. And chamomile, it's such an ubiquitous plant. We see it all over the place, you know, people using it for tea, but chamomile really does help with relaxing the muscles. It's high in vitamins, in calcium and magnesium, and it really can help those skeletal muscles relax. You're welcome. I hope that helps, Deneen. Gain some of the knowledge that you have. Where can I become a so you can take training. There's a herb school affiliated with Smile Herb Shop called the Mid-Atlantic School of Herbalism. I'm one of the teachers there, and you can look on Smile Herb Shop's website, and they have information about our classes up there. Thank you, Diane. I'm glad you're inspired. Thanks everybody for letting me be here.
This is so great. Thank you so much, Colleen. Wealth of knowledge and just amazing.
That was not what I planned at all. So
yeah, well, I think we really enjoyed the elder tree in your backyard. Seems really beautiful. Sounds like a great place to put a hammock up there or something.
Yeah, it's pretty wild. I'm right next to the Beltway, believe it or not. But
yeah,
it's
yeah.
Thank you for allowing me to participate with your community, Dr. Wong. I feel honored.
Thank you, Colleen. We'll definitely have to have you back for more. We'll talk more also. So yeah, thank you so much for coming and for sharing all your knowledge and wisdom here.
You're welcome. Take care.
Thank you.
Bye,
Thank
everybody.
you. Thank you, everyone. All right. We'll see you guys next time. So next week we'll have a, let's see, I think, let me go back to the presentation. We have 1 minute here. Thank you so much, Colleen. That was wonderful. And I'd love to have you back for more of that. Hope that everyone got benefit out of that. I know I did. I learned some things. I'll talk to you more about the questions I had too. And then thank you so much, everyone, for joining and participating and asking those great questions. We'll see you here next Thursday at June 4th. Everyone from the small communities invited again. We're going to talk about intravenous nutrition with our head IV nurse, Laura, next week. And we'll talk about nutrients and how that can work with herbs and immune system boosting practices like acupuncture and other natural healing modalities to really help your body, mind, and spirit. So we look forward to seeing you next week, and we will go from there. I think there might be some, let's see, is there anything else? Yes, so yeah, everyone's really thanking, and yeah, this is gonna be great. Yeah, health education, I agree, Angela. And this is a silver lining for sure. The recording is coming. Yes, absolutely. Yes, so we'll send out another link, and we can share it with Colleen and with Olivia there at Smile, so we can kind of work together on that. Thank you, Natalie. Look forward to seeing you at some point. If you're interested, we can talk to Gina as well. Yep, we're definitely going to share that. Oh, we already have the webinar link for next week. There you go. There's your first opportunity right there to do that. This is so great.